On this episode of 26 Minutes with Dr. Warren Siegel, I'm joined by Dr.Selwena Brewste, the Chief Quality Officer here at New York City Health and Hospitals, South Brooklyn Health. Dr. Brewste brings a deep passion for patient-centered care, shaped by her upbringing in Queens, New York, where she was raised by hardworking parents who dedicated their lives to healthcare. After completing medical school, she pursued dual residencies in internal medicine at the University of Connecticut and emergency medicine at Rutgers UMDNJ, becoming board certified in both specialties. Her extensive clinical training and her leadership experience allows her to approach patient care from both operational as well as clinical perspectives. As our Chief Quality Officer, she combines her medical expertise with emotional intelligence to drive quality outcomes, support our staff, and improve the overall care experience for all of our patients. I'm so thrilled, Dr. Brewste. I know how busy you are, but I'm so thrilled that you're on the show today. Thank you for coming.
I am so happy to be here.
I'm fascinated by your bio. You've trained in 2 medical specialties. Tell me why you did that and how that happened.
The why behind it, right? Let's do an RCA on Brewster. Coming fresh out of medical school, I wanted to lead the crusade for HIV, and so internal medicine was the thought initially. After doing approximately 2 years, and probably my 3rd year, it hit me that I didn't want to stop, that the emergency department was an area that when I was there, I just felt alive, renewed. I was really motivated by the fact that you didn't know what was coming in. You had to think quick on your feet. And then with the background of internal medicine, I had that foundation of understanding the pathology of diseases. So I felt like combining them both would actually really allow me to serve patients in a way that I had never thought of before. So I think overall, early on, I had this goal of serving, and how would I serve best would be by combining both of those areas of those specialties.
That's fascinating. I mean, it's a long path.
It was.
So tell me about your role here. What are you doing now as our Chief Quality Officer?
So it's great because it pulls back from where I started, right? So as an internal medicine doctor and an emergency room doctor, I laugh sometimes and tell people I'm bipolar because I can speak both languages. I'm able to improve workflows that actually bring out outcomes that ensure the safety and the quality of care that our patients receive. So when you're comfortable and well versed in multiple areas throughout the house, it's kind of like being bilingual. You're able to really speak the language of both areas. Thus, you're able to bring out smoother outcomes, better workflows that equal to improved patient outcomes, improving patient safety, and also allowing our clinicians and our clinical team, or just our whole hospital team, to have an environment in which they want to come to work, they feel safe, and they understand that the CQO is also here for them too.
So CQO, the Chief Quality Officer.
Correct.
So that's fascinating. Correct me if I'm wrong.
Yeah.
It sounds like instead of seeing one patient that a doctor might see in his or her office, you're actually looking at a hospital almost as if it's a patient and saying, how can I improve the system?
Correct.
The system is your patient.
Correct.
What a great way of changing healthcare.
Correct. I still work clinically, and when I'm at the bedside with patients, I feel honored, right? Because they're trusting me with that information and with their lives, right? To make sure that I give them appropriate care, and then I'm doing it with safety first. When I'm at the boardroom, or when I'm working collaboratively with other healthcare providers, that lens has to be panned up a little bit more. So I'm able to affect more patients, right? But I still always miss being at the side and having those intimate relationships with patients in the sense of them, that one-on-one. But from a leadership approach, I feel honored to have a seat at the table and give the perspectives of what an internal medicine doctor, how they're looking at it, what an emergency room doctor or clinician or nurse, how they're looking at it. So I feel honored and privileged to be able to have that experience on both ends, and again, to improve outcomes and to improve the quality of care that our patients receive, because that's what it's about. Patients just don't want care. They want quality care.
So let's talk about quality.
Yeah.
A lot of people talk about national patient safety goals, and I'm not sure our patients know what those are. What do we, when we talk about national patient safety goals? Can you talk a little bit about what that is?
I love this question. I love this question, and thank you for giving me the forum to be able to share this with people. I'm speaking right now to your audience. When let's just say there's a patient right now that's watching your show, I want them to know that when they come into the hospital, there is a whole system built on ensuring their safety. And that system has goals, benchmarks, right? And we are graded on them, all right? So I'll give you an example. National Patient Safety Goal number 1 has to do with making sure you're seeing and treating the right patient, that you're identifying the patient correctly, right? So we have goals in which we follow, or rules that we follow when patients come into the hospital and they're asked your name, what's your date of birth. It's not just because we want to get to know them and we want to make sure that we have the right, person. It's also to ensure that they're not going to get harmed, right? Those 2 patient identifiers allow us to ensure their safety. We're giving medication that, although is good, it also can cause harm. And if we mix up a medication because maybe your name is similar to the person next to you, right, that could cause you harm, negating the whole reason why you came to the hospital. We look at it this way. Patients come to the hospital, yes, to get treated. But the worst thing you could do is for someone who's coming in and asking you to help them is to harm them. And we get that in healthcare. We get that at South Brooklyn Health. We understand that patients are afraid, and I'm happy to be on this forum to be able to let everyone out there know that it is our goal and it is a priority that we're ensuring their safety. And that's what the National Patient Safety Goals do.
This is fascinating. So it's not just about coming to the hospital to feel better. You're saying that we got to treat the right patient at the right time, in the right place,
yes.
Which means you're going to have to ask me my name and date of birth. That happens so often. It gets annoying from the patient standpoint, but it just makes sense.
Can I say something to you too? I would love to give a tip to your audience too. If you go to a facility and they just ask you that once, that's an issue. You should hear it every step of the way. Every transition of care, they should be asked, what's your name? What's your date of birth? And it's not I know it can be annoying, especially when you're ill. The last thing you want to do when you're battling maybe an upper respiratory infection, or you're maybe battling cancer and you're just weak, right? But if your viewers could just understand that we're doing this because we want to ensure your safety while we get you better.
That's really very helpful. And and it may be annoying when you're weak, but it's annoying when you're feeling good and you've seen the same doctor for the last 5 years.
I think you're right.
I have that experience as a patient. So tell me about some of those other patient safety goals besides identifying people.
Good, yeah. So National Patient Safety Goal number 1 is number 1 for a reason, and that's the one we just discussed, which is the 2 patient identifiers. There are others that are very important to me, I think. One around medication. Right, and making sure that when patients come in, that we're looking at your medication and actually comparing them with the last time that you were there. And also, we call this medication reconciliation, right? Because we are going to possibly give you medications at the hospital. But if we're not looking at your prior meds, we might miss an opportunity that could actually save your life, right? Because if we give you 2 meds that actually work against each other, that could be a problem, thus impeding on your safety, right? So reviewing patient medications is also a National Patient Safety Goal.
So what can I do as a patient? Let's say I'm in, God forbid, an automobile accident and I'm brought to the emergency room.
Yeah.
What can I do to improve the likelihood that you're going to be able to identify my medications? I've never been seen at hospital X.
Yeah.
How would you know?
Amazing question. Great question, especially for me because I've worked only at trauma centers pretty much, or centers that are high acuity, level 1 and level 2 trauma centers, just like we have here at South Brooklyn. In the emergency department, patients come in, and I'll tell you what the best example is for your viewers. A patient comes in, like yourself, say if you got into a car accident, and we actually take your clothes and we put you in the gown and we get your wallet, and inside your wallet, because you can't speak, maybe because you've had injuries to your face, is a list of all the medications you're on. And what if on that list it said you're on a blood thinner? But if you didn't have that list, we wouldn't be able to tell what medication you were on. So in situations where you can't speak to us, or your memory just isn't great, like mine, or just on a normal day, sometimes you forget the dose and how to pronounce the medication, having a list is so helpful. So I would advise for your viewers, I don't care what age you are, 17, 15, all the way to 102, write your medications down. Or in the day and age, everyone has a cell phone, take a picture of it, right? Take a picture of it and then print it out, because trying to get on the cell phone might be hard in a situation. But overall, I think the main thing is to keep your medications close written and accessible for at a time that you might not be able to speak.
That's really helpful. You know, I often think, what happens if I can't tell you my medication?
Yes.
Or I forget. I mean, there are times I forget to take my medication.
Yeah.
What about the role of family members? You know, I always think of what would happen if somebody calls my kids and they come to the emergency. They have no idea what medicines I'm on.
It's hard for them.
What could families do to help support all of us?
They too also could carry this list, right? And I would even say in most cases that's probably the best thing to do, right? To have not only for you but also have the person that you know is your emergency contact. And also, must plug this, having an emergency contact is very important. Having that person, maybe something written in your wallet, well, this is the person you call if something were to happen to me, and a phone number that they can be reached at all time. And also give that person your medication list. And also tell that patient what you would like. Tell that, family member what you would like, right? If something horrible were to happen, right? Because we all have our wishes for our bodies. And in hospitals, we want to make sure that we are doing right by you, right? We don't want to do things that you would not want done. So educating that family member or friend, your neighbor, anyone who you think would be there for you with your medications and with your wishes as far as what you would like done.
That's really helpful. I was just thinking about you mentioned cell phone. On my cell phone, I actually put in my emergency contacts. So now I can actually add my medications and be able to change them when my doctor changes them, so that it's not the list from 5 years ago. It's actually recent. And that's really very helpful. Also helpful when I go to my own doctor and he or she says what medicines you're taking.
Correct.
I can whip out my phone because I can never remember the names. Yeah.
I want your viewers to really take it serious when a provider, a clinician, anyone goes over their medications with them. Medications are helpful, but they also can be harmful if they're not appropriately addressed and if it's not watched appropriately. When they are going over those meds with you and they say, Selwena Brewste, are you still taking hydrochlorothiazide? Are you still, I know it can be aggravating just like the two names, but all of these checks and balances that we've built into the system are there to ensure our patients' safety. You remember in medical school, do no harm. Do no harm. So it's really nice that I have this platform that you're giving, that we're sharing this information, because I don't know if all patients know this from what's going on behind the scenes.
No, I'm sure nobody does. In fact, some of us in hospitals don't understand everything about it. I know we don't have time to go through all the patient safety goals, but how many are there?
Oh, it's 15.
15, right?
Yeah,
That's
yeah,
what I was thinking. And the show isn't that long. But, so we hit 2. Are there others that you say our viewers really need to take seriously? Or are they mostly hospital things that we need to deal with?
No, I think there's a lot of them that they could take seriously, but I also want to talk about one that it's really nice, because this was actually the most recent one, was about equity of care, equitable care. Not everyone we're not all the same. We live in different areas, we're exposed to different things, we have access to certain things, and there's some disparities, as we all know, throughout our country, throughout our state, and even within the city. People are at different areas. The National Patient Safety Goals are they also push and remind us that we should be providing the same care, or allowing patients to get the same care regardless of if they can't have access to something or not. So it kind of levels the playing field, and I think patients need to know that we're thinking about if they have access to certain things when we're prescribing medications, right? So we're making sure that we're looking at the prices of things and making sure that it's in alignment with patients, so that they can actually get these medications. Or if we're saying, okay, I want to send you to another provider, to ensure that they can get to that provider. Do they need services to get them there? Because again, it's not a one shoe fits all, right? One size fits all situation. So I want your viewers to know that we're actually thinking about them and their individual circumstance. And the National Patient Safety Goals pushes that too. Because if you think of it like, well, I know they have access to that, and maybe they don't. And now you've put your patient in an unsafe circumstance, and they can't get that medication, or they can't get that access. That's a problem.
So you're talking about access to medications, but there's also access to actually seeing a physician.
Correct.
Right?
Access. No, I'm also saying
just
access
getting
to
through
care.
the front door.
Yes.
Access to care. So tell me a little bit about what, in your role, what do you do here at South Brooklyn Health to make sure that everybody has access to our providers, not just in the emergency room, not just after a car accident, but primary care, and more importantly, from our viewers, this show is about prevention, about getting people through the front door to get preventive health care and screenings for diseases. What's your role?
So we work. I always tell people that, because a lot of people say, CQO, what do we do? We're the jack of all trades. There is no care without quality, right? So we work collaboratively, and I pride myself on that, saying that we work collaboratively with all of the services, social work, case management, with operations. We work collaboratively with our chief growth officer, right? And that's a good example of one of the initiatives that we work collaboratively to ensure that there are certain services that are available for patients that would not normally have them. So this collaboration from our seat allows us to do this type of work of reaching out and making sure that everyone can get the care that they need.
So are you saying that everybody can come through the front door, regardless of insurance status, regardless of immigration status, sexual orientation, country of origin? Are you saying that the doors are wide open?
I am so proud to say to you, yes.
It's something I think
yes,
everybody needs to know, and something I'm very proud of.
I wish you could ask me that again,
yeah,
because I think they need to hear that.
Yeah,
and not every institution can say that.
Yeah. So let's go back to your role
Yes.
as the Chief Quality Officer.
Yes.
Is this something new? Is this different?
Oh,
or
no.
does every hospital have a Chief Quality Officer, and is this the new way of doing healthcare?
So no, I just think, quality lead with grace. We've been around. My mom retired from Harlem Hospital as a nurse more than 40 years ago, and 30 years ago, excuse me. And there was a quality seat there at that time, a quality lead. There's always been quality leads. Quality has been around for years, and I'd be afraid if it wasn't, right? Who wants care if it's not quality care? So when I'm asked, what do you do? If it's a patient that's asking, my job is to ensure that every aspect of your care is done with quality and that's patient-centered. So as the CQO, we lead buckets such as risk management, right? What does risk management do? We mitigate issues that might come up that might lead to patient harm, right? And also us making sure that we give our staff the tools that they need in order to ensure that the patient care is pristine. All right. We're also over the patient safety division, as we just discussed. Patient safety officer is also into that bucket. Regulatory. The CQO leads the regulatory crusade to ensure that different agencies such as the Department of Health, right, and the Joint Commission, right, CMS, we work collaboratively to make sure that we are following the regulations to keep our doors open and to ensure that we're doing things the right way, okay? In addition, we lead all of the quality assurance and performance improvement done in the house. So every system, just like, I'll give you an example, the automobile industry, they have a system of quality. The airline industry, they have a system within quality. Every system that has processes needs someone to constantly ensure that these processes are being done at its finest, all right? There's always someone that's needed at the table to challenge whatever's going on. We challenge processes in a graceful way to ensure that they're being done well, to ensure the quality of care is the highest, the safety of care is the highest. And when we find areas that there's room for improvement, we pivot, we engage the staff to come up with ideas that can improve the processes. So I would hate to think of a place that does not have someone with a role similar to mine.
Huge job, and I'm sure the team has to be large to be
Yes.
able to do this kind of job. I don't want to get away from the national patient safety goals, but specifically, what can our viewers do to help make sure that when they come to a hospital, whatever hospital it is, or a doctor's office, that they're getting the highest level of quality and safety? You mentioned keeping my medications up to date.
Yes.
You mentioned making sure that I'm identified as who I am.
Yes.
And letting my family know where my medications are listed, how to access them, and what I want. Is there anything you want to tell our viewers today of how they can help partner with us to make sure they get the highest level of care possible?
Just in general, I really would love to support our patients to just ask why. Why are you doing this, doctor? Why am I taking this, doctor? Why do you feel I don't need to see you in a week but 2 weeks? I find, at my stage in my career at this point, I do recognize when some patients have questions, but they're just apprehensive to ask. You have to be your advocate. Advocate for yourself. Ask the questions that you're afraid to ask. We don't bite. And that will ensure, because 9 out of 10, I tell you, patients come in, they know more than we do half the time. They know what's going on. So sometimes, just trusting their gut. I want our patients to trust their gut. If something doesn't feel right, ask why. You could actually stop something from happening, right?
It's interesting. I remember, I don't know if it was a commercial years ago, I remember hearing the phrase, an educated consumer is your best customer. And I've always felt that way when I'm seeing patients, and I'm constantly saying, I want you to ask questions, but you're right. I'm sitting there in a white coat, they're sitting, across from me, and they, out of respect or fear, they're afraid to ask. So that's a wonderful a goal for all of us to have.
Right, when you think, as opposed to them going through each national patient safety goal, like, they're all great and they're all focused on them, but the thing that I think I want to leave your audience with is ask the why. When you're thinking about calling your cousin who maybe is a nurse to ask the question, put the phone away. Ask yourself. And if the physician or nurse, whoever the person is saying it using terms that you don't understand, don't be embarrassed to say, I didn't get that. Can you repeat that for me? And then I'm going to take it a step further. I am really begging your viewers, take your pen and pencil. If you're like me, you'll forget everything was told to you by the time you pull out the parking lot. Take your pen and pencil out and write down the things that the doctor or the nurse or whoever's caring for you is telling you at that time.
This is wonderful advice. I'd be remiss if I didn't add one more thing.
Yeah.
Ask for an interpreter
Oh.
when you need it, and don't be embarrassed
Yes.
that you don't speak English,
100%.
perfectly. I don't speak any other language perfectly. In fact, you could argue I don't speak English perfectly. But we have a large population of non-English speaking people. It's not their first language. They
Yep.
speak English, but it's not their first language.
Yep.
And so how do you deal with that as the Chief Quality Officer?
So again, that is so true. As the Chief Quality Officer, we lead the team that deals with patient relations and patient experience. And under that, it has to do with being advocates for the patients. We have a group of team members in the hospital who bring language interpreter machinery over. We have a wealth of that in our hospital. And most hospitals at this time, they do have these interpreter services. We're actually, at this point, transitioning to putting that on bands, right? To allow, before you even open your mouth and approach a patient, you'll see a band that says this patient speaks Russian, this patient speaks, so you're not even saying one word to them without getting the proper interpreter in front of them, because they shouldn't have to miss one word.
And that includes sign language. By the way.
100%.
Another one of my pet peeves.
Mine too.
Right.
Mine too.
Right.
I think that we have come so far, and we've got much further to go on ensuring. I'm going to just add another thing. Being over risk management as the CQO, we deal a lot with RCAs, right? And
Just explain what an RCA is.
Definitely can. Those are root cause analyses. So if there's anything that happens within the hospital that deviates from what we think should have happened, we do a deep dive into it. So I would love your viewers to know that we take any deviation or anything that's abnormal in our standard of work very serious. Just as the airline industry and the automobile industry, they've been doing these RCAs for years. Again, root cause analysis. What we found is that one of the leading causes for deviations is communication issues. So, as you mentioned, language services, things of that sort. Communication is key. Ask the whys I want your audience, please ask your clinicians why. Use language services if needed, because the area that actually has that's the area for improvement is around communication in healthcare.
And we can never communicate too much.
No.
Thank you once again for being here, but thank you for what you do every single day, keeping all of us safe.
Thank
Not
you so
just
much.
our patients, but our employees
Yes,
as well.
yes.
Safe, quality care, that's what we're all here for.
Thank you.
Thank you so much. And that brings us to the end of our program today. Thank you for tuning in and learning alongside of us. For more information about our show, please visit us at www.zormed.com and stay updated with South Brooklyn Health by visiting us online. This broadcast was brought to you by Brick Media in partnership with New York City Health and Hospitals, South Brooklyn Health. Until next time, be safe and stay well.